I want to turn it over to Carrie Mitchell, our regional rep with the Board of Pensions, and turn it over to you for a little while.
Moderator, thank you so much. I really do appreciate it. And you'll see that I'm sharing screen, and now I get to rearrange all of my screens because you all have disappeared from the one that I was in front of. So bear with me as I put you back where I want you to be so that I can see you, the most important part of my conversation with you tonight. There you are. That's the way we want it to be. So friends, I bring you greetings from the Board of Pensions. As moderator has said for us this evening, I am your regional rep, or as we are now called, church consultants. And the reason for that is to get across this one message if you hear nothing else tonight. And that is, we're here for you. We want you to understand that the board is seeking to be a different entity. I'll get to that in a second. But for those of you whom I have not had the privilege of meeting yet, I wanted you to know that, oh, how very much that worship spoke to me. Because having been a pastor for a couple of decades, my single favorite action was to baptize. So Christopher, Mildred, and Deb, thank you so very much for reminding me of that and for giving us all the opportunity to plunge into those waters of baptism and be washed and refreshed so that we might continue our evening. Let us do some refreshing together. Let me refresh your memory about why the board is here and what we hope to do for you so that you know we're here for you. You might know this history. You might think that the board is only for pastors. And certainly when we were founded in 1717, that was the intention, was that as the fund for pious uses for widows and orphans, we were set up to take care of the widows and orphans of pastors. But here's some good news. The board is not your father's Oldsmobile anymore. We're not just for pastors. We're actually serving more lay people now than we are pastors. And with our 65,000 plus members, we're offering all the benefits that you see on your screen. In 2021, we reorganized the entire benefits plan into these three main categories. We offered new plans, as you see in the red outline, and we are trying to emphasize to you, as you take this information back to your churches, your worshiping communities in whatever form, that there are benefits for any employee. So think about those things. You might say, well, Carrie, we can't afford it. Or Carrie, we don't have employees who work long enough. There are actually three benefits that can be provided to any employee who gets a W-2 from the church, regardless of the number of hours that they work. If they work an hour in your daycare situation, they can have access to dental, vision eyewear, and the retirement savings plan at no cost to the church. And if they work more than 20 hours a week, they can have anything that you see on that screen. And I'd be happy to talk to you about more of that. I'll be putting my contact information in the chat, and a much more thorough PDF of this presentation will be shared with Shannon and with David so that they can get it out to you. If you've got questions, please be back in touch with me. But tonight, I'm just going to take a little bit of our time together to cover two main topics. What's new in 2022? And you'll see that we have expanded our assistance program, and we've introduced a new feature to the medical program called Care Navigation. So with that, friends, let's dive in. The assistance program, what is this beast? It's been around for many, many years, and it is entirely gifts. Gifts that are funded by gifts. I want to assure you that the pots of money at the Board of Pensions are well barricaded from one another. Pension funds pension, dues for medical fund medical, and gifts from the Christmas Joy offering and from individuals fund our assistance grants. And because they're assistance grants, they are not taxable income. They are used entirely by the recipients. We gave away in 2020 $9.3 million. You heard me right, $9.3 million. And our goal is to give away more in 2022. So what are the changes to the assistance plan? I'm going to talk to you about them in three different categories. The first are assistance grants for all active members. adoption assistance, transition to college assistance grants, and emergency assistance grants. Let me take the middle one first. Emergency assistance grants are just as their name would imply. If you're a member of the plan and in an emergency situation, be in touch with Shannon and with David and work with them so that they might apply to us for a matching grant. The transition to college and the adoption assistance grants, both of those amounts have been increased in 2022. It used to be that for adoption, there were only $3,000 available per child. Now we're up to $6,500 per child. And that transition to college assistance grant, it used to be that you had to be a freshman in college going to a four-year institution for you to be eligible for $1,000. We've augmented that to $2,000 to anybody doing post-high school education. It could be a four-year, a two-year experience, a trade school. And you can apply for that, your dependents can apply for that until age 26. And if the dependent goes to a Presbyterian Church USA entity, they can have up to $3,000 for that grant. So those are the three grants and the changes for 2022 that are available to all. Now, how about the question of grants that are available to ministers in active service? We have a brand new grant. It's a pilot project called Minister Debt Relief. The goal, of course, is to relieve the debt of pastors. And if you find yourself in a situation where you are carrying either consumer debt or educational debt, you can apply for this. We'll walk you through a orientation program that you can take online, and then put you in touch with an Ernst & Young consultant who will help with financial planning and reducing that debt. And at the end of that process, we'll give you up to $10,000 to reduce that debt. The Ministerial Educational Debt Assistance Program has been around for several years. It continues to offer up to $25,000 for those who qualify to reduce educational debt. And then finally, you see the Sabbath sabbatical support. Pastors, this has been a heck of an experience going through COVID. And ministry was tough enough even before the pandemic hit. We're now increasing those Sabbath sabbatical grants up to $4,000 from the previous level. So please be in touch with us, take a look at the possibilities, see if you're eligible, and then apply. We want to be able to fulfill that for you. Finally, our assistance program has 3 different grants for retirees, spouses, and surviving spouses. The goal of these, of course, is so that anyone in retirement does so in dignity. And if you meet the income barriers and the amounts of time that you would be either in the pension plan or in service that would have otherwise qualified for the pension plan, then you can have access to these grants. It's one application for both the housing and the income supplement. And let me give you some good news. Again, in 2020, the housing supplements, we gave away $1.4 million. The income supplements, we gave away $2.74 million. We want to give away more. And then finally, those retiree medical grants are for individuals every 3 years, if you're income eligible, for monies for hearing aids or dental work, because Medicare doesn't cover those. Up to $2,500 grant every 3 years. Friends, those are a thumbnail sketch overview of the assistance enhancements. Let me talk to you now about Care Navigation. What is it? Well, imagine with me for a second that you are actually getting on a plane. I know it's hard to imagine because I know many of us have not had an opportunity to do so, but go ahead. Imagine with me that you've gotten on a plane, you've arrived and you're going to pick up your rental car and you're in an entirely different surrounding. You don't know where to go. A lot of our rental cars are now equipped with some kind of navigation mechanism. And if you've ever used that and that tells you make a right turn 200 feet up ahead and you follow it, then you've done navigation. Care Navigation is much like that. We're in unfamiliar circumstances, unfamiliar territory when we deal with our own healthcare needs. You talk to a surgeon and they'll tell you, oh, knee replacement surgery, it's not much. no big deal, we'll get you through it. To the surgeon, it's not a big deal. To the person getting the surgery, it's a big deal. So how could we use a Care Navigator? Care Navigator can be used for the right time, the right place, the right care at no different cost to medical plan members. So the care coordinator can take care of that particular knee replacement example. You would call into our new partner, Quantum Health, and get a Care Navigator. You can say, I've been told by my orthopedist that I need a knee replacement. You can talk to the Care Navigator about potentials for if you think you might want to get a second opinion. Care Navigator can talk you through that. The Care Navigator can also talk to you about centers for excellence, because these are Blue Cross Blue Shield entities that make it possible for individuals to not have to pay the coinsurance, because you go to a place that has statistically had better outcomes for these kinds of surgeries. The Care Navigator can then talk to you after you've had the surgery about, well, what do you do for rehabilitative care? Are you going to a situation that's going to be in-home with a PT coming in, or will you be in some kind of a step facility where the PT is right there, and you get to experience a different kind of meal in that surrounding? The Care Navigator can help with that. And then finally, you get home, you're done with all of this rehabilitation, and now you've got the explanation of benefits and possibly some claims to pay. You could talk to a claims specialist with the Care Navigator. They're there to step you through this unfamiliar territory. This is all going to start transparently to members in the medical plan on April 1st. Between now and April 1st, members of the medical plan, either the preferred provider, the exclusive provider, or the high deductible health plan, will be getting new Blue Cross Blue Shield cards in the mail. Now, if you're like me, over the years, I've gotten so many of those that I didn't pay attention to them. I'd use the one that was already in my wallet and throw away the new mailing. Friends, please don't throw this one away. You want to trade it out, because the number on the back will be different. It will give you the direct link to Quantum Healthcare so that they can help you with all of these points that we talked about, and assistance with Express Scripts, our third-party pharmacy benefit provider. That's a quick overview. I'm here for a little bit longer. I will be sharing the greater information with your wonderful Presbytery leaders. And if you've got any questions, I would be more than happy to answer them. I'm going to stop sharing screen. Be delighted to answer any questions, like, how would I access this, Carrie? We'll give you that card, and that number will be available to you as of April 1st. Any other questions? Seeing none and having made it very clear, moderator, I return to you the remainder of my agenda minutes.
Carrie, thank you so much. That was really helpful, so informative, so clear. I've got a page full of notes from your presentation already, so thank you so much for all of that.
My pleasure. Make certain you use that transition to college assistance grant in another 17 years.
Well, yeah, well, I've got that marked.